If we think about it, biosimilars were brought to market to create competition and drive down costs for biologic agents within the healthcare system. And with that process, it was supposed to benefit everyone within the healthcare ecosystem. So payers, patients, providers, distributors, all of everyone was supposed to have a benefit in this market. And so for a very long time, I do feel that patients have benefited from these savings directly as well as indirectly. And so when we're speaking of indirectly, if the provider of the healthcare system is realizing savings because they have reduced cost of biologic agents, they're able to shift those dollars to other things that could benefit the patient's health and provide a full line of service for their patients because they have cost savings in other areas such as drug costs. For direct savings, I would say that we probably could do a better job at using models like what we see with the IRA with insulins, where they have a cap on the costs for patients in that space. These are life-saving medications, and for biologics in oncology, rheumatology, we also see that some of these are very life-saving medication as well. So maybe having some, policy-driven aspects to controlling out-of-pocket costs and putting some caps on what our patients actually pay to decrease that financial toxicity for some of these disease states that they're already realizing from care that's outside of medications will definitely be beneficial. And so to say, do I think that bringing more savings to patients is what we should be focused on? The answer is absolutely yes, because patients is the center of all of this, right? Without the patient, there would be no distributor, there would be no provider, there would be no one. So our focus should always be on the patient and always finding ways to make their care better and more affordable for them, but also while providing the highest level of care for them. Also in this, we know that biosimilars are for cost savings, but when we are switching, we're going to go back to that same component. Patient education is going to be key. And within that, we also have to minimize any disruption to that patient's care. We don't want to make a financial decision that could possibly be at the detriment of the patient. So making sure that we level all of those out and looking at the entire patient and the entire care for that patient is going to be essential in making sure that we increase the utilization of biosimilars as well as increase the amount of care that we're giving to our patients now.